Hello, I'm Brian, and we're here today with a pretty special episode of AAMI News and Conversation. We're here at AAMI Exchange 2023 in Long Beach, California. We're actually kind of teeing up right now before the expo hall is about to open, so I'm excited about that. But right now on the main stage is our keynotes, and my guest was just introduced as one of the big award winners of today. Shauna, can you introduce yourself and tell us what the award was that you won?
My name is Shauna Mullally, and I'm the recipient this year of the Robert L. Morris Humanitarian Award from the AAMI Foundation and ACCE.
Excellent. And
Yeah.
yeah, this is, I love this award personally because humanitarian work with, especially within health technology is always very impressive because yes, health technology is always something that it's for the patient good of the patient. Patients come first. It's something we often hear. So that is inherently humanitarian. So you have to be stepping above and beyond, right? This is this is something very interesting. I wanted to point out to our guests, Shauna has worked in places as communities in Gambia, Zambia, Denmark, Guinea-Bissau, London, and most recently the Canadian subarctic. And I'm sure our listeners and our viewers are going to be wondering, what were you doing there?
Yeah. I've had the privilege of doing lots of different types of work within the kind of HTM area and low resource settings. When I was in the Gambia, I was the head of biomedical engineering for the British Medical Research Council. So I had a team of technologists who did all of the equipment maintenance. We did equipment management services at a number of different research sites in the Gambia and Guinea-Bissau, and also clinical services as well. And then when I was working in Zambia, I did a few different projects for NGOs and bilateral donors, needs assessments for kind of human resources for health technology management in Zambia, needs assessments and kind of post equipment project implementation audits. And I worked as well on a project that I really loved, which was starting up a training program at a college in Zambia for biomedical engineering technologists, which was the first program in the country. There was no BMET training of any sort in Zambia before that. Yeah.
That's, I mean, that you created a
Yeah.
pipeline. That's
Yeah.
really great.
Yeah.
I also saw in your, I guess the application for the award that there was one, the birthing centers you were very
Yeah.
proud of as well. You want to talk a
Yeah,
little bit about that?
sure. This was a project outside of work, but related to it when I was living in the Gambia. So one of my colleagues who worked on my team there, who became a good friend, his name is Ibrahim Anyasi. I used to go hang out with his family and visit them in the village that he grew up in, which was about an hour from where I was living. And just being privileged and coming from a place like Canada, where lots of my family and friends at home were saying, is there anything we can do? Is there anything people there would like support with? I ended up getting to know people in the village really well, and chatted with a lot of the women and the elders and said, if there were some resources available, what would you like to do with it? And what they really wanted at the time was a dedicated birthing center in the village, because women in the village prior to our birthing house had, if they delivered at home, they were kind of delivering maybe inside or maybe outside of their homes, not particularly kind of private, or not a very nice environment for all the women from the village to gather for the birth. And then the closest health center was many kilometers away, and transportation was a challenge. They said, we'd love birthing house if that's possible. And my family and friends fundraised for it. And it was a total grassroots initiative. Like, we did everything together. It took a number of years to design and plan and build. And it opened in 2011, about half a year before I moved away from the Gambia. And it was just such a joyful celebration, because this was the first time in this particular village in Penyam that the women had physically had their own space for this very important life event where they could gather and support each other. And it was also a space where women would come together and work on different crafts or do anything that they wanted to, really. It was just their space. Which was quite special. And yeah, there have been many births in the birthing house over the years. But what's also been cool is we have a maintenance fund for it, for when maintenance is required. We have a fund for supplies that's ongoing. But it's grown and become a health clinic in the village. So there's a visiting doctor, visiting nurse who come periodically and provide different health services as well in this birthing house. And it was such a joy and privilege to be involved. And it was just nice to be able to support these women in the village to kind of realize a dream of theirs, and they made every decision, from the design of the building to how it was built, to all the equipment that we got in for it, to how the opening ceremony would go, to how the space was used. It was their own, which was just a real privilege to be part of.
Yeah,
Yeah.
and I know you mentioned this was kind of a side project,
Yeah.
a grassroots initiative,
Yep.
but it is very indicative of the work that you've been doing,
Yeah.
which is about accessibility.
Totally.
So I want to go back to that and talk a little bit about, all right, so this is health, you're bringing healthcare technology management
Yeah.
to these regions where they might not have access to maintenance
Yep.
devices. What are normally the major causes of, oh, we need help in this area?
Yeah, that's a really good question. A number of things. Equipment is often not available.
Mm.
So the equipment just physically isn't in health centers or hospitals. It's also often technically available, but it's not usable. It's not maintainable. So people haven't been trained. The clinical staff haven't been trained on how to use it or aren't competent or comfortable using it. The biomed or other maintenance personnel in these facilities haven't been trained on how to maintain it. They don't have the right tools or test equipment. They don't have parts. Um, and there's also a real kind of mismatch when I would go into hospitals and health centers often for these assessments between what equipment they actually required in their different wards for their services and programs and what they had there. And that's because most equipment was introduced to hospitals and health centers through donation programs from overseas and through bilateral aid programs, which would often be focused on a particular set of health interventions. So like emergency obstetric neonatal care, for example.
Mm.
And so I visited hospitals where there would be like a whole room full of, say, 30 incubators and infant warmers, but they would have one or two oxygen concentrators that were being kind of moved all around the hospital as they needed them. So that's a challenge as well. And I would say one of the biggest challenges is the kind of knock-on effects of procurement practices or equipment introduction into these health systems that mean that there aren't resources and there aren't people who are available to maintain the equipment to keep it running. And so very high quality, expensive pieces of equipment there'll be an issue or even just a user issue with knowing how to operate it. And then that equipment, all of a sudden, that very expensive resource is unusable because nobody in the facility has been trained to adequately service it, and they don't have access to experts who could advise them. Like everywhere, but particularly in low resource settings, like the biomed in the basement phenomenon can be quite challenging for actually having equipment that's working to help support the clinicians to deliver safe patient care and
Right.
quality care.
I want to talk a little bit about what actually causes this to
Yeah.
be a problem.
Yep.
Is it always just an education problem, or is it also just location? Very isolated
Yeah.
communities.
Yeah, that's a really good question, Brian. It's both, and it's many other things. So
Mm.
definitely education challenges around like clinical staff and say biomed or facility service staff
Yeah.
is a challenge. Remote locations, it's hard to get equipment in. The procurement practices when equipment is introduced into these systems is often just the capital cost. So there aren't budgets created. There isn't money available for servicing, whether that's by external service providers or in-house personnel. There aren't trained in-house personnel. There aren't kind of trained service techs in the region. Like for some of the equipment that I've worked with in different low resource settings, there might be one service engineer for many different countries. So you can imagine the challenges. Exactly. Even if there is kind of financial support and money to pay that person to come and do that technical work, when are they going to be available?
Right.
So that's a big challenge. Yeah.
I can imagine because even in the U.S. right now, especially during COVID-19, but even before and after, there's backlogs with
Totally.
the technician from a specific company, a manufacturer, et cetera. So
Totally. Yeah.
much worse in some of these areas.
Yeah.
I can imagine.
Yeah, totally. And I'd say another area that's very challenging is equipment that is designed for use in a very high resource setting and then is used in a low resource setting. And what I mean by that is like equipment that requires very reliable power, for example, might
Can you
be
give us a specific example, maybe?
Yeah, sure. Like, for example, lots of equipment in low resource settings has to be procured with its own standalone generator because if it's expecting reliable power and it's designed to only have battery backup for, 20 minutes, for example, and the power goes off very regularly, you need to plug that incubator into a generator, a small UPS generator that's going to keep it running when the power goes down in the hospital, or systems that are designed like with COVID for oxygen infrastructures that are plant-based or piped when it's actually just concentrators that are available to deliver oxygen. Issues with Things like environmental conditions, so like high humidity, high temperature for equipment can be a challenge when equipment is designed to be used in an air-conditioned hospital somewhere big. And really the kind of reliability and durability of equipment and its component parts that might be transported along like bumpy roads, you know what I mean?
Oh,
Or left out in the sun for a long period of time.
right.
Yeah, there are a lot of kind of environmental conditions that also,
Might not be a
yeah, might be kind of a stressor on the actual equipment, apart from the kind of system stuff. Yeah,
When you brought up the generators, I
yeah,
was immediately thinking, oh, I don't know if manufacturers are thinking about compatibility with the
yeah,
generator you might find at some of these
totally.
areas.
Yeah. So for lots of big projects, those UPSs are specced out and supplied along with the complex equipment that
Mm,
requires that type of power input because they have to be.
yeah.
Yeah. And sometimes that's missed and they're bought. You know what I mean?
Yeah. So
Um,
I guess this is where your knowledge would
yeah.
come in.
Yeah. Exactly. Yeah.
That's
Yeah.
amazing. We're talking about kind of, these main things that you've noticed, trends, challenges.
Yeah.
Um, is there any general lessons learned that you've been able to kind of carry it through your different locations that you've been moving to?
Yeah, that's a good question because I've been lucky to do different types of work in
Yeah.
different types of places. I would say one of the lessons that I have learned over and over again that I like to try to share with people um, is we often think of challenges with equipment in low resource settings where we hear stats like a lot of it is out of service, it's not available, it's not where it should be, there are challenges using it. And we tend to think it's an equipment problem.
Mm.
And it's never at its heart an equipment problem. It's a people problem. It's a system problem. It's a capacity problem. And that goes for training programs. It goes for initiatives where equipment is introduced by a donor for a certain program. It's even applicable where I work in the Canadian subarctic, just having available techs to be able to do that work. And they'll often have to get on a plane and travel to a very remote community to do service on the mobile X-ray system kind of the next day. So technology issues are at their heart almost always about the people. Are the people available to support the technology to use it safely and effectively? Do they have the right training and competence? Because without that, a system can't function with equipment. There's always going to be a need for new replacement equipment. And it doesn't set health systems up for taking advantage, especially in resource limited places, of the scarce resources that they actually have.
You've built this wealth of knowledge and you've been moving it from project to project. I have to ask though, and for our viewers, this was a question that I haven't asked Shauna yet because I actually didn't want to
Yeah.
spoil myself. I wanted to know how the heck you got into this in the first place. What led to all of this?
Sure. When I was in high school, I was into school. I was quite nerdy and I loved almost everything I was studying, but I really loved science and math.
Yeah.
And when I was getting ready to apply to university, I was thinking, engineering or science, I'm not really sure, but they both seem exciting to me. And I chose engineering and I didn't know what type I wanted to do at all. So I started out in aerospace engineering, not having a particular background in it, but just being advised by my guidance counselor in high school. If you start in that program, because it's quite challenging, you can move into other types. So in my first year, I learned that I actually loved programming. And I did an undergrad in systems and computer engineering because my brain has always been kind of a systems thinking brain. I love thinking about how things fit together and seeing the connections between things. And I always see things as a system. So I really enjoyed what I was learning. But during my co-op placements in high tech, I was excited by what I was learning, but it also just didn't feel like the right fit for me. And I've always been interested in healthcare and I've always been interested in travel and going different places. And I also wanted to find something that I could study and a career that I could get into that really felt like it was at the kind of front, kind of human facing edge of how engineering can improve people's lives.
Yeah.
So I was studying biomedical engineering and I was also taking courses in international development policy. And I was interested in systems research on what makes health technology management or clinical engineering services effective in low resource settings. So that's what I actually did for my thesis work, was studying that type of kind of organizational input. What makes these services likely to be able to do their jobs in very resource limited places. And so through that, I got to do field research in the Gambia at the British Medical Research Council. And when I finished there, when I finished my master's, I went to work in the Gambia. And then I eventually took over as the head of biomedical engineering. And honestly, one thing led to another. I was quite excited by where I was working, and I wanted to see and work in different places in Africa. So I went from the Gambia to Zambia. And then I was interested in kind of seeing things from a higher level perspective. So I had some work with UN organizations. I did a bit of work with the World Health Organization in Geneva, and then a couple of years with UNICEF in Denmark as well. But I always just kind of checked in with myself and tried to kind of get a read on myself as to whether my next career step was something that felt right. And it always did at the time. And I also feel incredibly lucky. Like I've had such opportunities with my career that are quite exciting. And that's a real privilege. And I don't tend to be the type of person who plans everything out in advance and executes it. I like to kind of say, okay, what makes sense for me now? Does this still make sense for me? If not, what's going to make sense for me next? But what I found when I was actually working in the field is that there is such a dearth of HTM knowledge and kind of expertise and capacity in low resource settings that I was in a very privileged position because there were always lots of opportunities available to me for where I could take my career next. And I just wanted to work in different places and try to contribute with different aspects like service delivery, training, kind of human resource planning for HTM, more technical work, and get a bit of a mix of it in my
So
career.
often when I talk to the technicians, here at Exchange or even within some of our committees, one of the things they say is they stick with the job because they love helping people.
Yeah,
They see that
totally.
ultimate
Yeah,
impact of what
yeah,
this might be, something that they can then think about.
yeah.
Are there programs and opportunities that you would point them to if they wanted to help out in low resource settings?
Definitely. There are like lots of initiatives for both training programs.
Mhm.
Probably many of your members have heard of Engineering World Health, for example, which is a great American-based organization that does training overseas and capacity building. The Tropical Health and Education Trust, which is a UK NGO that I've done a lot of work for and with, facilitates the development of training programs overseas. And I would say in most countries I've worked in, I can think of specific organizations who are doing work around capacity building. One of the things I worked on with SET in the UK was also trying to create an enabling environment for British hospitals to support their clinical engineers and their biomeds, their HTM professionals, to do the same types of overseas missions, as they're often called, as doctors or nurses are able to do. Because that's a big part of it as well, is like supporting these professionals in our hospitals to use their skills overseas.
Right.
Yeah,
Almost like Doctors Without Borders.
totally. Yeah.
That-
Oh, yeah. Engineers Without Borders is another
there
organization
you
I was
go.
involved with for a long time. Yeah.
It's just too long of a
Yeah.
CV at this point. No, I love it.
Yeah.
And so you have been on maternity leave for
Yeah.
a while.
Yeah.
Congratulations.
Thank you.
When you return to the field, what is
Yeah.
next?
I'm going to be back at my job in the Northwest Territories in Canada. But I love my team there. I love the work. And I also enjoy being involved in international initiatives as well. So one of the things I'm involved with at the moment is a new initiative on appropriate medical equipment. So this is an initiative a few of us globally have come together to start working on. And we're really looking in the long term at trying to develop some sort of voluntary certification system for testing and a methodology and framework that can actually qualify and identify medical technologies and devices that are appropriate for use in low resource settings in the kind of areas that I've talked about earlier. Like, are they easy to operate? Are they easy to maintain? Do they have low power and infrastructure requirements? Is it easy to get parts? Those types of things. So that's pretty exciting. And I'm also working with the Global Clinical Engineering Alliance, which is a new organization, new-ish. I guess we've been around for a couple of years. A global organization focused on advancing clinical engineering globally as a profession.
Right.
Yeah.
Yeah, and I think Amy has talked about, we've launched a partnership with
Yes.
well,
Exactly.
kind
Quite
of helping
exciting.
getting that HTM knowledge
Totally.
out there.
Yeah.
Very exciting.
Yeah.
And I guess that's a good call to action. If people want to get involved,
Yeah.
I guess they could, GCEA,
Yeah.
great.
Totally.
This other project that you were mentioning, is there a call to action there or submissions, anything like that?
Right now, we're getting up and running and figuring out where we fit. But I'm sure that there will be in the near future.
All right.
Yeah.
So our viewers can keep an eye out.
Definitely.
We might have some exciting news about it in the future. We'll
Totally.
see. I'm looking forward to it. Well, Shauna, this has been a really great talk. I've learned so much, and it's an aspect of HTM that I personally didn't think about until it was brought up. Of this is a kind of impact that I think a lot of HTM folks might not think about immediately. But a good way to have a influence on the world.
Totally.
All right.
And one thing I'll just say in closing is
Mm.
one of the things that I found so inspiring about the COVID
Mhm.
pandemic
Yeah.
that we've all been through is that there were challenges faced in hospitals and health centers in very high resource settings that were what I've seen many times over in low resource settings. But also, it brought the clinical engineering and HTM community globally together in a very practical way very quickly to share knowledge and to even do things like learn from resource poor settings and high resource settings when we were faced with these kind of unprecedented challenges in environments like this. So, through something awful, I feel like that's been a real gift for our profession, actually, is the kind of the solid bond of these global networks that we've developed in response to that.
Just,
Yeah.
progress through adversity.
Yeah,
Thing.
totally.
Oh, that's
Yeah.
fantastic. Well, congratulations again
Thanks
for
so much.
winning the AAMI Foundation and ACCE's Robert L. Humanitarian Award.
Thanks.
And I'm looking forward to hearing more about what you can accomplish in the future.
Thanks so much.
All right.